Isn't it crazy how some of the simplest things in life can amaze a guy, just like looking out the window, watching that squirrel play across the tree?
Good morning.
Good morning, Carrie. I heard somebody behind me.
I'm sneaking up on you.
That's all right.
I got your back.
Hey, this is well. You should see my phone. Anybody talk to Neil? I haven't heard a peep out of him for 3 days now.
No, I have not.
I haven't either.
I hope he's planning on being here today.
I saw him before he, I knew me.
Maybe any break on the agenda then.
There's one I.
There's only one. We're not gonna do a lot. That's fine.
So,
There's none of that.
we can do allegiance and we need to approve the agenda. I realize the auditor forgot this week.
Crazy. That's convenient. I don't think anything. It doesn't seem like it.
Anybody invest in Zoom?
Mm-mm.
We should have.
Right?
Anybody what?
Invest in Zoom.
Actually, it's not going down.
Actually, Zoom's been taking a beating the last week. Ever since the announcement of the vaccine, Zoom has been going down every day. I think they're wrong.
I think you're right, Rich. I think they're wrong.
Well, I think they're wrong because I think a lot of companies are going to stay with this even when we get past this.
I agree.
I see lots of advantages. There's some disadvantages, but
Well, why spend millions for brick and mortar when they can do it from people's homes?
brick and mortar, insurance, all kinds of things that factor in.
I see ISAC moving more this way.
I think they could too. I wouldn't know why they couldn't.
Good morning, everyone.
Good morning.
I mean,
Good morning, Dean. Good morning, Becky.
So,
thanks for joining us today, Becky.
yeah, thanks for having me.
Stephanie, where are you at?
In my office.
Oh, that's cool. Behind you there.
Now I'm at the beach.
There you-
And real quick, I'm gonna run across this bridge. My wall in my office is pretty plain. I haven't had time to decorate.
How do you do that?
You go up to your right-hand side where it says more, and then you can chat, meeting settings, virtual background.
See,
Yeah, I had to
Becky's-
download.
Have them preloaded?
I had to
Yeah.
Oh,
download.
look, she's at a football game.
Yep.
Yep, I'm gonna be somewhere else on Monday.
You better
Tree
be.
stand?
You better be out of that crowd there, Becky.
I know.
You gotta have some fun with Zoom.
Oh, now I can't take mine back off.
Except the game.
There we go.
The iPad, Carl, you know.
Mhm.
Morning, Neil.
Morning, everyone.
Yeah, morning,
Becky?
Neil.
Tell Becky that I congratulate her. I got an Iowa background. I want to congratulate Iowa on their big and only win.
Oh boy, throwing that out, huh?
You would improve your situation though if you had an Iowa State background. Yeah.
Oh my goodness.
Not that-
Oh, I wish we could go back to September, what was it, 12th, when that game should have been scheduled. That, you know, even though Iowa wasn't on the schedule, Iowa State still lost that day, didn't they?
We have an Iowa background too.
You had to bring that up, didn't you?
There's
You
Carl.
started it.
I'll talk real slow.
Hey, Neil, I just want to remind you the trophy's still in Iowa City.
Mm-hmm.
Who's 5-1 at the top of their conference?
But we're talking the Big 12.
That's why you've won a game.
All right, I think we'll get the meeting opened up. It's 9 o'clock.
Okay.
If you guys want to do the Pledge of Allegiance today, we certainly can. If you do.
Yeah.
Okay, very good. Let's do that. I pledge
Pledge allegiance to the flag
To
of
the
the
flag
United States of America.
America,
And to the republic
and
for
to
which
the
it
republic for
stands,
stand, one
one
nation,
nation,
under
under
God,
God,
indivisible, with liberty and justice for all.
Okay. There are no minutes, so we're going to just approve the agenda. And one little nuance here. Carl's going to watch the questions. He's going to give me a thumbs up if we have some. We've already had one. I will ask that question here in just a little bit. This is COVID-19 related. This may get divided into two sections before we're done. We'll see where the conversation leads us. First thing I want to do is let's go ahead and approve the agenda for today.
I'll move to approve the agenda.
I'll second that.
Okay, we have a motion and a second for the approval of the agenda. All those in favor say aye.
Aye.
And opposed? Motion carries. Okay, the first thing I want to do is Becky Benami is kind enough to come in and she made a presentation yesterday at the Board of Health. I only got a chance to see about 20 minutes of it because I had 2 Zoom meetings going at the same time and I needed to jump in the other one because we needed a quorum. So, Becky, would you want to go through what you got for us today, which should help with everything you had yesterday?
Sure. Okay. Just need to have the capability to share my screen, and I can go through. Oh, yep. If they can enable that for me, I have a.
Carl's working on it.
Okay, great. Yeah, I just put together some statistics. We had a regularly scheduled Board of Health meeting yesterday, and we thought it was a good time to really provide key education. As you all know, the state of COVID-19 changes daily, but we've really seen some troubling trends in Carroll County, and we really feel like now is the time that everybody needs to understand where we are in the county right now with our rate of infection, and how the trends are impacting our businesses throughout Carroll County. So I'm going to bring up a PowerPoint here and just kind of walk through this a little bit. All right, can everybody see my screen now?
Yes.
Okay, great. Looking at the state of where we are, every day our 14-day positivity rate changes a little bit based upon the number of people that have tested the day before. But we have been dangerously high for quite a few weeks. And in the last 2 weeks, we've really reached a critical zone. It's not immune to Carroll County. This is all across the state, but Carroll County has had a more pronounced increase for quite a bit longer than our neighboring counties. They're starting to feel the impact what we've had going on now. So as of this morning, our 14-day positivity rate was 27.2. And to put that in context, Typically, the recommendation with the CDC to show a safe amount of community spread is below 3%. So we're pretty high right now. I went back through all of the data from when the pandemic began. And of course, Carroll County, we were one of the first states to have a COVID-19 positive case. And that alarmed people in the beginning. But we kept with just one and very minimal cases all throughout March, April. In June, we started to tick up just slightly. But if you look at this curve, this is the actual plotting of when we had new positive cases. We had, what you would call a pretty flat level curve. We were increasing, but not exponentially. Until we got about the middle, end of August, and then our numbers really started to tick up. We got to the end of September, and they started accelerating even faster. And now you can see, since we've been in November, we're just on a speeding freight train right now. We have a very bad trend, and when you can tell by seeing how our line is going almost straight up and down. What's probably more concern, well, not probably, what is more concerning is the rate of our deaths right now. We have had 10 deaths alone in the last 30 days. And this chart shows how that has occurred through the course of the pandemic in Carroll County. Breaking that down, between October 12th and November 12th, we had 699 new positive cases. In 30 days, we had one shy of 700 new positive cases in Carroll County. That alone shows you we have a very significant spread. Going back through, I didn't want to track our daily cases from the beginning of the pandemic because that really doesn't tell you much. What you need to look at is your recent history. So starting from about October, middle of October, when public health staff really started to notice our cases were picking up, you can see that we very consistently, with the up and down of the bars, you can really correlate that back to the days when you get the results back from Test Iowa. Now, Test Iowa is a free test for individuals. They can go to St. Anthony as a Test Iowa site. And so they do a high volume of testing on Mondays, Wednesdays, and Fridays. So those bars, that shows like every few days when you get those test results back, you're seeing higher numbers because you're having higher test dates on those particular dates. But now we're getting a trend when even on our non-Test Iowa dates, when McFarland Clinic is testing, when other providers are testing, they're still getting tremendous numbers and tremendous numbers of positive cases. So this trend right here, yesterday, we broke our record. We had 63 new positive cases. And in this last week, I think I have on my next slide here, I got to move my picture out of the way. From 8 a.m. on Sunday, October, that's November, yep, 8 a.m. on Sunday to 11:30 a.m. yesterday, we had 229 new positive cases. So that was a 5-day total. That was more than the 5 months total that we had from mid-March to mid-August. So that is pretty significant to put that into context. And as we know, increased cases lead to increased hospitalizations. Right now, the way the state of Iowa has broken down the hospitalization data is that there are different regions throughout the state. Carroll County is included in RMCC Region 1. And right now, there are only 30% of all inpatient beds that are available right now in the whole region. And I'm going to bring up this website, but I don't think, yesterday I wasn't able to share it. I think you're still just seeing my my PowerPoint screen. So I'm just going to scroll down while I'm talking and just give you the latest numbers on this website that right now in this region, and this is a big region in the state of Iowa. As I mentioned, there's only 30% of inpatient beds available. There's over 1,200 patients hospitalized in this region. So this is including our local hospitals in that data. 240 patients in the ICU, and 213 patients that were just admitted in the last 24 hours. And all of those numbers are up from yesterday. So I just want to point out, with giving those statistics, talking about the state where we are right now, this is not just a public health crisis. I know that our public health nurse, our public health department, is the one that typically provides the updates to the public. But it's not just a public health crisis right now. We've really expanded beyond that. This is not just a healthcare or a hospital crisis. This is not something that we can just look to St. Anthony Regional or Manning Regional Healthcare Center to help lead us. It really is a countywide crisis. And it got to that point because the spread is so significant that now it's impacting the availability of daycare providers, preschool. I don't know how many different daycares within the county are shut down. I don't have the exact data on that, but they've been having outbreaks amongst their staff, amongst the kids. That trickles down to parents that are healthy, but then they don't have daycare, so they can't go to work. We have several businesses right now that are shut down because they don't have enough healthy staff to be open. And what I mentioned before with the hospital capacity, it is multiplied because this spread is now going in, and our healthcare workers are also being impacted right now. So what can we do in Carroll County? Well, we have three options that I see it. We're all fatigued. So we can throw our hands up and say, I'm done. Let's just see where it takes us. We can do what we're doing right now, which is we have some mitigation efforts in place, but it's not enough because our trajectory keeps rising exponentially. Or we can look and do something very significant to try to affect change and have an impact and slow down the surge of these numbers right now. Because as we found out yesterday, our public health director in our Board of Health meeting pointed out that based upon the modeling through IDPH, through tracking of the data in their software system, if things continue as they are right now in Carroll County, we will double our cases in 30 days. And right now we're over 1,600 total cases. So of those total, we will have another 1,600 in 30 days if we don't make some significant changes. And I'm not going to open up these website links right here, but I do encourage you, I can send this out to make sure everybody has this presentation, but CDC has newly released guidance. Now, since we're several months into this pandemic, there is a load of information now that has been peer reviewed, it's been studied, it's epidemiological, it's statistically significant, that shows the impact that community masking can have on reducing the spread of COVID-19. Also, there is a great study that just came out from the University of Kansas, and it shows a comparison just within the state of Kansas. Some counties earlier this year implemented a mask mandate, some didn't, and the data is very clear that shows that the counties that do have the mask restrictions or recommendations in place have a slower increase and less numbers overall than the counties that don't. So the next slide here, I just pulled a little bit from that CDC study that just showed the integrity of the study, how valid the data is, how conclusive it was, and really want to point out the last sentence in there that really shows the economic impact, which I feel that we are seeing locally by businesses that aren't being told to shut down, but they are shutting down because they don't have enough healthy staff right now to operate the business. So that leads to the recommendation that the Board of Health gave yesterday. And I will just go ahead and read this. We released it on the Public Health Facebook page. It's been shared a number of times, but this is why, looking at the data that I just shared with you, this is why we came to this conclusion, that we feel due to substantial community spread of COVID-19 in Carroll County that is impacting daycare accessibility, safety of nursing home residents, availability of healthcare workers, and rapidly shrinking capacity for hospitals across the state, the Carroll County Board of Health is encouraging all residents to increase preventive measures to help slow the spread of disease. Therefore, all county residents are asked to do the following proven and effective preventive measures. Wear a mask in public, stay home if not feeling well, avoid large gatherings, socially distance at 6 feet or greater whenever possible, frequently wash your hands. Furthermore, the Carroll County Board of Health would like to encourage area schools and businesses in the county to institute mask requirements to help slow the spread, and ask the Carroll County Board of Supervisors to implement a temporary mask mandate to ensure the safety of our residents in public spaces. And I will stop my screen share there. And I just want to conclude also by saying another troubling aspect of why our numbers are as high as they are is we don't have a singular source that we can attribute it to. We don't have a massive packing plant outbreak. We don't have a correctional facility in the county that's having a massive outbreak. We just have a lot of factors that are all contributing and unfortunately all accelerating at the same time.
Thanks, Becky. Like I said, I got a chance to see quite a bit of that yesterday, but I didn't get to see it all. I want to ask a couple questions here. And I tried yesterday, but I ran out of time. Out of 100, let's just use 100, out of 100 people that have been certified that they have the disease, how many does that translate that most likely will need hospitalization? Is there any way we track that? Will we get 6 out of the 100? Will we get 20 out of the 100? I know it's kind of hard to tell. It depends on which age group, but right now, am I right? We're seeing it across the board in age groups. So I know there's 32 beds. I just see that in the chat that Sarah put on. If we're looking at 5 or 6%, we're going to gobble up those beds in 7 days. And then we're going to be out. And I can attest there are hospitals that are out of beds. I have a daughter that works in that field, and they're struggling. They are looking for every little nook and cranny they can put somebody. So it is real, and it's not that far away from us.
No, the numbers have accelerated just far too quickly to be sustainable right now. Just from one aspect of contact tracing, there was a point this week where we had over 100 people on the spreadsheet for Carroll County that needed to be called to try to begin contact tracing to figure out where they picked up the disease, how many people they potentially spread it to, who's at risk. It's substantial. I can't answer, I'm not qualified enough to answer your question. I didn't realize it was yours yesterday. I did write it down. And I just haven't had time to get that answer, but I know that hospital staff can answer that.
Well, I just thought maybe you had read it or seen a glimpse of it someplace in the information you've been reading.
I have, but I don't want to give the wrong data. So I'd like to double check it before I say.
And thank you for not taking a stab at that. We don't really know. That was one of my questions. I also know that we are testing people with symptoms. We're not doing the mass test where and I know that that's probably driving our numbers higher. That's part of it. But I also know that there's a lot of people with symptoms, otherwise we wouldn't be testing them. So that's the other side of it. There's a lot of it out there.
So it is, I just want to address that. It is a little bit of a misconception that it's only people with symptoms that are getting tested. You have a lot of individuals, and it was like this all throughout the summer. Now I think some elective procedures are starting to be scaled back, obviously to conserve hospital capacity. But anybody that had an elective procedure needed to have a COVID test first. People that are changing jobs, anybody that's working in the nursing home right now, they're getting tested twice a week. So there are a lot of, quote, healthy people that are getting tested because they need to have that test result for for a routine medical procedure, just even like a colonoscopy, anything at all that they're in the healthcare facility, they're getting that test first. Like I said, new jobs, changing jobs, things of that nature. So there are a fair number of what you would consider as healthy people going in. This is not like it was in the beginning of the pandemic when tests were so limited. They were really being conserved for the sickest of the sick, to make sure that they could have the right course of treatment. But where we are right now, that you can't jump to that conclusion that it's only sick people getting tested.
Okay, very good, thank you. Does anybody else have any questions for Becky? Carl, how are we doing online?
No comment.
Becky, have you read the resolution that was passed in Greene County?
I haven't read the whole thing yet. I've been, but yes, I was given a summary of it.
I think it pretty much or mostly covers the your Board of Health's recommendations. I don't think it hits them all, but hits most of them.
Yes, I would agree.
Becky,
It's
you also had mentioned that there were several businesses, and I don't want you to name them or anything like that. You know the rule. But are there quite a few? Are we looking at maybe 20% of our businesses are struggling with employees because they're not here or not present? So they can't have their doors open. They can't function along like they were.
Well, that'd be difficult to make a projection because right now, it wouldn't be a valid statistical analysis because I'm just basing from what I'm hearing. So it's more of a convenient sample. I also know I've also been pitching in to help with contact tracing for the county. So I see some information from individuals that have been contacted, and then perhaps they are a business owner, and then they say their business is going to be shut down for 2 weeks. So that data I couldn't give, but I know just anecdotally from conversations too, and I know Dean was aware of a couple just from wanting to do business yesterday when he made phone calls and was surprised to find out that they were shut down. But I know it also that trickle down, the availability of daycare has been very difficult recently, and that is impacting a large number of families who are still healthy, but they have no one to watch their kids right now. So they've been unable to go to work as well.
Well, and Becky, I had discussions yesterday and in the last couple of days. I know of at least 2 public entities that have departments that are struggling with employees. So I think this is a real thing. We're going to see bigger issues here.
Well, I also was on a meeting yesterday, and there were 6 county supervisors from 6 different counties. One of them was Green, we know what they did. The other 4 has been moved right up to their regular street. They are really taking a long look at it. Yesterday, you mentioned there was 2 counties that are struggling with these numbers. They are, I think one of them is Greenville County. I think it's like in the 8% range, someplace in there, and it's part of the populated county. But I also know we have been on mainly at the schools since the first day of school. So I believe that has really, really helped keep that spreading. So they've eliminated an age group amongst spreading amongst themselves. And I think that was extremely wise of them to do that. So I think there's a little proof out there that we can ask for. I hear a lot of people complaints they that say, watch this video, tell you line up I say that they do work. So, and I don't always say the same thing. January 1st of 2024, what the right answer is. But we won't know until then. I think there's a lot of information that we need to have. We're still learning. But I think we have to have and move forward. with what we-
Rich, I'm gonna stop you for a second. It's really, really hard to understand you.
Are you getting back feed?
Yes.
Yeah.
Somebody online
Somebody needs to mute.
in here?
No.
And I don't know if you guys saw this in our chat, we have had a public question, and it was, of the 70% of inpatient beds used, how many are COVID related?
I suggest everybody mute unless they're talking.
Can you guys mute up a little bit?
Stephanie, I'm looking at the report sent out last night, so give me a minute.
I guess one situation that alarms me is the availability to transport very ill patients to Unity Point, Mercy, etc. I talked to somebody from Webster County yesterday and said they had to transport a very ill patient with COVID to Iowa City because that was the only available place that they could go. So, I mean, that is alarming to me. I mean, we have great hospitals here in Carroll County, but they don't have the medical acuity, to take care of very ill individuals. But that is the reality. Can you address that, Becky?
Yeah, there's not much more I could add to that other than the number of people that first, I just want to say that both hospitals are beautiful. They have state-of-the-art equipment. They have a highly skilled staff, but they do have some limitations. There are very few of their staff that are capable of operating a ventilator or, some really high level types of care like that. So that would fill up very quickly if it got to that point locally.
And it also takes a tremendous amount of staff. If you've seen any pictures of caregivers in ICUs over the last 8 or 9 months, you see that there's about 4 or 5 people around these individuals, trying to do what they can. And I don't know if we have the staff.
Yeah, when you have
Here.
critical patients like that, it's a big push to have enough staff there available because you have to have all hands on deck. And so that limits their labor pool immediately just with the numbers of critical patients because your ratios change and you have to increase the nursing care.
Apparently the action taken in Kansas has been very effective. I have not read the Kansas one. Has anyone compared the Kansas requirement to, for example, what has happened in Greene County? How do they compare? Because if we take action day, I want to be action that makes a difference. And what has been done in Kansas has made a difference.
I know we can't take action today because on the agenda it says discussion only. So there wouldn't be enough public notice to actually take action today.
I would, in answering your question, Neil, I was very interested in the Kansas study, and it was totally unbiased. I mean, the data that was collected was from the Kansas Department of Health, and so they were the numbers just like we work with here. As far as I can't say anything to Greene County, but I can tell you that I did talk to John Straight from Harrison County, the supervisor chairman there. And they've had a mask mandate in now, probably they're approaching 2 weeks. And I asked him if he saw any difference. And he says, and they had also had a unenforced mandate. And he said, well, we've had a tremendous amount of sickness in our county, and of which we have here as well. It was pressed by the Board of Health there, and the chairman of the Board of Health is a doctor from the community. He said, I got tired of seeing all my patients die. And they had a tremendous spread in the nursing homes in Harrison County. I asked him if he's seen any results from their mask mandate. And he says, well, I've seen a lot more masks being worn in businesses. And so he feels that it's made a difference. And one thing that interested me was, he says, well, we don't have to enforce it because, there are other people, our residents and our citizens are doing the enforcement for us. So, you can take that for what it's worth, but, I think we've got a serious problem here. And other counties are taking action. Wright County took action this week as well. They implemented a mask mandate, and they also implemented a gathering size to no more than 10 people. So they took another step. Page County, I'm not sure, they were going to have a discussion on this. I'm not sure where they ended up. But
just to add to that too, Dean, the State Board of Health met yesterday, and they made a recommendation yesterday to Governor Reynolds to issue a statewide mask mandate. And I want to clarify one thing that is in both those studies that I shared with you, and in all of the studies out there that shows the effectiveness of community masking. You have to remember that both parties have to be masked. There's a misconception that's out that I hear over and over again in the community that, well, my neighbor down the street, she always wears her mask and she got COVID, so masks must not work. And I ask them, well, your neighbor down the street, is she around everybody else that wears a mask too? Because if you don't have both parties wearing the mask, you don't have that maximum effectiveness. And it has been found over and over again that if just one person is wearing it, it can still be transmitted. But some of the studies, especially in that CDC study, it shows a hairdresser that was actually two of them that were positive and didn't know it, but they were wearing a mask, and all of the clients that they had were wearing a mask, and nobody contracted the disease from them. So there is effectiveness. I'm not going to say it's 100%, because depending on the mask, if it's not a medical grade, there's never 100% with anything. But that is what these studies are showing. That is why they are calling for the community masking, because the more people that are wearing them, the less likely it is to spread the disease.
They're also calling for, online learning, hybrid learning. Our county has not done that. Our county wants to maintain kids in school 5 days a week. So they're calling for people to go back to working online. We still have 100% of the workforce working at the county level at these businesses. So if you're trying to keep 100% in person as to everything we're doing, ESAC went hybrid. That means the kids are only in school 50% of the time. The Polk County schools all went online effective Monday. We're not doing that. They want the kids in school 5 days a week.
Well, just for the board's information also, the ambulance crew that we have is functioning. We are still waiting on a couple of test results. We should be able to hold our shift work there but we're getting dangerously close to having to make adjustments. And I certainly hope the public understands that if we don't do things like this, we can lose that service, and that's a very valuable service. Also in our treasurer's department, we're down to 3 employees. There are adjustments have to be made there. So it's not just affecting just localized, it's affecting everywhere. So the services that we have are going to have to be adjusted. That's why one of the reasons why I said we may have to divide this into 2 pieces today. I don't believe we can pass the resolution today without it being on the agenda. And so that will probably have to wait till Monday. That's kind of a borderliner. But what we can do is we can make adjustments to our courthouse immediately, because that has nothing to do with, it does have the stuff to do with the general public. But so I would recommend that we adjust the courthouse today and bring this resolution back on Monday. Or we'll leave it up to you. We'll attack it today if you think we can get away. If we think
Well, I think it's on, COVID discussion, that covers a lot of things. And just from the emails I got, I think people got a very good understanding what some of the discussions are going to be.
Yeah.
I think we're in a situation here, we need to either crap or get off the pot. I mean, sorry to say that, but I think these numbers that Becky has provided us are very disturbing. This thing is, if we don't do something, it's going south on us. Do I want to force people to do things? No. If people were doing what they should have been, we wouldn't have to be doing this. But, I think now it's become a civic duty, not a right.
And if I could just add in, just to also put into context the historical significance of public health making recommendations like this. Throughout the history of our country, public health has identified different issues that were impacting the health of the citizens of our country and made recommendations to make changes to improve the health of the majority of citizens, as many as possible. Going back in time, just mandating clean drinking water and sanitation. That was a public health initiative that identified a way to stop the spread of disease. Fast forward several decades, putting in speed limits on highways. That was public health stepping in and saying a high rate of people were dying from excessive speed, including seat belts. The list goes on and on. Asking that, making recommendations so that smoking was not in public places. So I view this as just another recommendation based upon data that's being put forth just to protect as many residents as possible. And yes, there are some people that don't like it and don't agree with it. And I do understand that. And we are asking for some sacrifice right now. But because of the urgent situation in the county right now, where our numbers are projected to go, and God help me, I don't even want to tell you what the numbers are projected for deaths, because that to me is just a little too scary. So let's hope that we don't see that, and try to do something that, again, is just a temporary, because we have to do something to solve this problem.
Well, and I agree with you, Becky. Just look at, you didn't cover that, but the last 10 deaths, the time frame on that was that's just unreal.
Mhm.
But I would agree with Gene that we need to proceed with this. I think it's we've done these types of situations before in recent memory. I have recent memory of this, and this one was actually I think there was enough preparedness from this group and from the county and from the rest of the residents in the county that they knew what was going to happen today, and I think there was enough notice.
Well,
I think
go ahead, Neil.
people are correct in saying that today is for discussion only. We aren't going to take any action today. But to taking the Greene County one as a template, would it be okay to put that on the agenda for Monday, or are there significant changes that our members would want to have on that? I like it myself.
I really don't needs any changes.
Okay,
No, I think it looks good to me. It's
let's
well thought out.
plan on putting that on the agenda for next meeting then, and then the public will know what we're looking at. And if there are some, any big changes, let's hear about them now or next Monday.
Courtney, did you have a comment about that?
Oh, I just said that when something's considered a crisis or an emergency, you can add things to it.
I can't understand you.
Well, you guys are all on top, so
Yeah,
I think that has to.
mute up a little bit. So what she's saying is if it's an emergency basis, we can change the agenda at any given moment. And we could vote on that today. It's her opinion of it. And makes perfect sense to me. So if the board wishes, we can go forward today, or we can go forward on Monday. So give me a consensus of which way you want to try to go.
Well, personally, I think it's an urgent enough thing that we need to do it now. Every day we buy, we might save more, cause less problems down the road.
I say we move forward today.
So we just need a motion to have it.
I'm gonna say, in my opinion, we hold off until Monday to put it on the agenda. I do want to commend you, Becky, and everybody for all their continued work and countless hours. And I do believe COVID is real, and it can be very detrimental to people that have underlying health conditions, and maybe not so detrimental to some of us that are of the age range where, we're active and we're not, we don't have any underlying health conditions. My concern is the word mandate. I don't feel that we need to move forward with the word mandate because there is no repercussions to that. I have spoke with the chief of police and the sheriff's department, and they do not plan on citing for the lack of masks. I also feel, in my opinion, that every business has a choice to make for their own business, whether they should allow patrons in with or without masks. Do I agree that people can hold? I think the governor's done a phenomenal job, just keep reiterating personal accountability. And I think we can really ask the constituents of Carroll County to do what's best and to mask up. I think you're going to get more people to do that on their own than using the word mandate when it has no validity. That's my opinion.
Neil, you need unmute, Neil.
I'll respond to that. In Section 5 of the Greene County ordinance, there is no penalty for violation of this regulation. So I don't think it's a mandate. I have no objection to acting on it today, but I do think that we should have it on the agenda on Monday for reconsideration so that between now and Monday, the public has a chance to respond to any action if we take action today. And we can make any changes, that we feel are necessary next Monday. So I don't object to acting on the Greene County ordinance or the Carroll County one that resembled it today, but I do want it on the agenda for next Monday for reconsideration.
So Neil, you have the document up, right, on the computer, correct?
I have it. Yeah, I printed it off. I have it.
Okay, so read the sentence right below the sentence that you read. I don't have it up, so I can't read it, but it says about the timeline.
Oh, it's section 6 says this resolution expires and becomes null and void after January 15th, 2021, unless the date in this section is amended, but the resolution is sooner repealed. Is that what you
Yeah,
want?
that's exactly it. So what that tells me is that we can go ahead and act on it today, and if we want to reverse it on Monday, we can do that. All right?
That's the way I think we should proceed, Dean.
Yep.
Can I bring up one thing about timing? This was discussed yesterday at the governor's press conference, that just try getting a test to Iowa or a test unless you're symptomatic anywhere. Unfortunately, we're up here with my mom at Mayo, and my sister was desperately trying to get 2 negative tests in a row because she had COVID in their household. The testing sites are full, even private paying $150 to get the test. So super frustrated for people who need, like it was mentioned earlier, need a procedure, need something done, need to have even the negative test come, and the testing sites are full. They brought that up yesterday. So we're talking about days, we're talking about action steps. So all the people who may be positive that don't even have an ability to get a test, still going about spread. That's just my comment, because the testing sites are full, including our location here in Carroll, because they weren't open on Veterans Day. They weren't open. St. Anthony's requested 1,000 more tests, 1,000. So
What can we do about that?
nothing. They are only testing, like McFarland Clinic has the ability to test at the doctors. You know, the doctors are the ones choosing. Dr. Heim was on the board of health meeting yesterday. 2 days this week, 50% of the tests McFarland submitted came back positive. 50%. So you have the test Iowa and you have the negative test, yes, bringing that overall county number down, but McFarland Clinic is basically testing symptomatic people, or the people that they're saying, yep, we need to run the test on you today. We're moving you up to the top of the line. Does that make sense? Test Iowa is for anybody. The people in the hospitals getting procedure, that's to get the procedures. McFarland Clinic is seeing the sick patients, and 50% of the tests came back positive. So.
Well, I guess we're probably gonna have to, we're gonna move forward with it today, where I guess we're gonna have a motion to adopt the resolution from Greene County. I'd like, as I read it this morning, it covers all the bases that I think that we should cover, if we're going to do that. And I do like the option that we can take it away if we see the need, the numbers drop down low enough. I'm starting, there's more and more businesses that have it up. This decision is gonna be made for us here pretty soon, because we're not gonna have any employees left anyway. They're gonna be out 2 or 3 weeks. And as I understand it now, some people are getting it back. It's not like you are that immune to it. So we're in this for the long haul. I think if you're going to go ahead with this resolution, I think we should get a motion on the floor and go forward.
Rich, yeah. Just last night, I was on Facebook, and after the Board of Health posted their recommendations on the Public Health Facebook page, I saw one business that came out and said, because of the Board of Health's recommendations for Carroll County, we are now going to mandate masks in our business. So just the mandate alone, even though there may not be an enforcement piece to it, is going to give some of those businesses that may have been afraid to do it because of public reaction, we're going to give them the power to do that.
Thank you, Jerry. We're gonna have to have a motion to place it on the agenda too. And we're gonna make the change and we're going to,
I'll make a motion that we place it on the agenda.
I'll second that. Neil seconds it.
we have a motion and a second. All those in favor say aye.
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 And opposed.
Aye.
Motion carried. Okay,
One more quick comment about testing. Sorry. Neil said, what are we going to do about it? In the governor's press conference yesterday, she knows it's a concern with the testing. She said that our current allocation of Test Iowa tests would be enough to get us through December 13th. And then her, along with every other governor, is working to find a new distributor to allow the state of Iowa to purchase more tests so she can continue the Test Iowa beyond that. So, I mean, there's nothing we can do. When St. Anthony says, Sarah, put in a request for 1,000 test kits, that's what I do. They have gotten them every single time that they requested, but we would have to get the numbers from the hospital. They go through 1,000 test kits quite quickly. And this was the fastest turnaround. She asked for the last 1,000 that she had asked for the week prior to that. So they would know the numbers though of how many they're going through on a daily basis.
I will make a motion to adopt Greene County's resolution for a mask mandate. Courtney has been so kind to configure this resolution to fit Carroll County. And I'm just going to read the last two sections. There is no penalty for violation of this regulation, which is not intended to be punitive or stigmatizing, but is in the best interest of the health and safety of the people of Carroll County. Section 6, this resolution expires and becomes null and void after January 15th, 2021, unless the date in this section is amended or the resolution is sooner repealed.
I would like to make a comment on that. I think that last section, the last thing we need to do is turn around and repeal this right away. I think we need to give it plenty of time to work and do its job. I think I've seen some things where we went out and did things and then we reopened things up and then it blew up after that on our face. So I think we need to give, that's why I do like the timing on this. And first of all, I'm not any different than anybody else. I do not like forcing stuff on people, but I think we're in such a situation here. We would be not doing our duty if we do not move forward on this. I think again, as it's in the best interest of all citizens of Carroll County. So Dean, did you make a motion on that resolution?
That was my motion. Yep.
And I will second it.
Right.
Yeah.
They may or may not receive it.
they may or may not receive. Have you guys seen the chat on the page? Are you seeing that?
Yep.
Okay, Carl wasn't sure whether you're seeing that. He wasn't positive how it reacts on your end.
Nope, I see it.
Okay, very good. All right, any more discussion on that?
I just got one more thing, and I respect your guys' opinions. But again, and I don't take COVID lightly, but I do feel it's a personal accountability issue. And if you've got underlying health conditions, you do need to stay home. And if you're of the elderly population, yes, I do believe you should hunker down and stay home and have other people. And if you can, stay home. I like the advice that the public health sent out yesterday. But in my personal opinion, I do not think we need to use the word mandate.
Okay, if there's no more discussion, I'm gonna call for the vote. Yes, I will. It's a resolution and we will do roll call.
Rebels,
Yes.
Yes.
Miners,
Yes.
Bach,
Yes.
Shetler?
yes,
Yes.
Houseman,
Nay.
motion carries.
Okay, that is the resolution. Do we need to tighten up anything here at the courthouse? In your opinion, or should I just go up and visit with the treasurer's office? And I'd kind of like to go back to what we were doing in May, where we had appointments only. She's pretty short-handed right now. I'd like to go back to that. I think we want to keep our services going as much as we can, even if it's a trickle, it's still better than nothing. But I certainly would like to roll her back just a little bit, cut down some of the traffic there.
So Rich, are you talking about going back to where we're doing appointments only?
Pretty much appointments only. That includes driver's license, everything.
Except for just her.
No, for the whole,
Well,
for the whole courthouse, right?
courthouse needs it. Yes, if they start getting sicknesses and don't have the people, I want to give them the availability of rolling their office back. If they think they should do it now, we'll do it now. But
They're already taking place driver's license.
but are they?
Yeah. I would suggest that we just go back to doing all appointments again for the time being. It's and again, this is a fluid situation.
I really don't know how much traffic she's getting because we're not in tax season. We're doing appointments on driver's licenses. We've been doing that. We stuck with that. So I don't know what kind of foot traffic she's talking about, but I don't want to close. I don't want to go alternating days. I want to stay open and run as much as we can.
Well, I think like Courtney's office now, her biggest work is going now until due budget, which that doesn't, not a lot of public get involved in that. I think maybe we just go the whole courthouse by appointments. That's what we were in the past. I don't know that we can segregate one department versus another. That's my opinion.
I don't have a lot of foot traffic in my office. Maybe I'll get somebody that'll just show up. Most of it is passport, which we're already doing. Most of it by appointment, except on Wednesdays, which has been our walk-in days. So if you want to go by appointment, I'll just have to start I'll have to let the public know that we're not going to be open walk-in on Wednesdays and that everybody's going to have to make an appointment. But as far as the environmental health stuff, we're headed out to do that. People are not coming in here to do that.
I guess I would like to get to the point, where we're taking precautions, we're being proactive instead of being forced to do something after the fact, which would be close the auditor's office down because everybody's sick. And when they get sick, they're going to be out for 14 days at a minimum.
Yeah. And
so, whether it be the treasurer's office or the auditor's office or the treasurer's office, the assessor or the recorder, I think that's what I think we want to prevent from happening. That's my opinion.
You guys are kind of sliding along okay.
Yeah, it's hard because, you could have to close for a few days. There have been many counties in recorders, treasurer's office that have had to close for COVID. And I know they struggled to catch back up. So I don't know. It's a hard decision.
The Harrison County had both their auditor and treasurer out, and it was challenging in talking to John Strait over there in Harrison County. And their treasurer was out in the hospital twice. So, and her husband was in the hospital for 45 days. So, take it for what it's worth, but I think it's better to be proactive than trying to fix this afterwards. And on top of that, there's no guarantees,
Okay, so where are we headed here? We're gonna just try to have the department heads try to limit the contact the best they can, but we're not shutting down. Let's make that clear.
No, I think just do appointments.
Okay,
So we're open by appointment only. So then the door is locked and people.
well, we can't lock the door because of the court system.
So then you're.
But didn't we, when we had the doors locked, didn't the clerk of court actually come down and open the door?
Yes, but they're running on a skeleton crew right now. They have backed off all their trials till February, jury trial. And they're running on a skeleton crew across their district. So.
Well, is this something that needs more research and get their input as far as whether or not we can lock the door? Can we wait until Monday for this?
Yeah, we can.
Why don't you survey the various elected department heads and get back to us on Monday?
Okay, we will do that.
And I also am with the understanding that we're going to put this resolution back on the agenda on Monday. And I know Gene doesn't want to be wishy-washy, and I don't either, but this is a fluid situation. And as 5 board members, we don't have a monopoly on knowledge and that type of thing. So let's look at it again on Monday after the public has seen it and a weekend to digest it and comment on it.
We can certainly discuss it. There's something you want to change.
Sounds good.
We can bring it up for discussion. If we decide we want to change it, we can change it then. If we decide not to do anything with it, we can just let it continue. All right. Anything else for we need to cover? Okay, anything else from anybody else? If not, I'll be taking a motion for adjournment.
I'll make that motion.
Okay,
I'll second.
do a motion
Thanks, everybody, for your time.
for adjournment. All those in favor say aye.
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 And opposed? Motion carries. Thanks for calling in, Sarah.
Thanks,
Becky.
Becky.
Thanks, Sarah.
Thanks, Sarah. Thanks, Becky.
Prayers to you and
Thanks,
your
Sarah.
family, Sarah.
Everybody be safe.